than 3 in 10 people suffered disrupted or disturbed sleep at some point during the first 2 years of the COVID-19 pandemic. This was according to a large systematic review and meta-analysis involving 493,000 people across 49 countries. Dr. Michael Vitiello is a professor of psychiatry and behavioral sciences at the University of Washington School of Medicine. He was a senior author in this large study.
The highest impact on sleep is not surprisingly in individuals who've actually been infected by the illness. But if you look at the next highest level, it's surprising, it's actually children and adolescents. And that's in the high 40%. Less so the general population, which is about 36% impacted. And in between that are healthcare workers, where they're about in the high 30s, low 40s. It was very surprising, a little counterintuitive that children and adolescents would be impacted so much. But if you think about it, they're the ones that don't have the information to process what's going on. They haven't learned the coping mechanisms, hopefully, that adults have. They're picking up on peer concerns, and they're picking up on parental concerns while they're there. So a lot of things can account for that sensitivity. We don't see differences between front-line healthcare workers and people who aren't in contact. That's very surprising. It seems just being in the healthcare mill is sufficiently impactful.
Insomnia and poor quality sleep were commonly reported sleep disturbances in this study.
You can experience what we would typically think of as insomnia, which is kind of anxiety related, where you're worried about things and as a result you have difficulties falling asleep, or you can experience what I call busy brain, where you wake up in the middle of the night and you start worrying about all these things that you have very little control over, but that still impact your life. So difficulties falling asleep, staying asleep, feeling unrefreshed, that's a huge proportion of the problems that are reported. And correspondingly, there is sometimes shortened sleep time as a result, because you don't get enough sleep. The American College of Physicians, now the VA and the Defense Department have all come up with position papers that the best way to treat insomnia is with something called cognitive behavioral therapy for insomnia. It's a behavioral approach. It can be administered a variety of ways, but the thing they don't recommend are other less effective behavioral approaches or any short-term drug treatment. So the gold standard treatment would be cognitive behavioral therapy.
Dr. Vitiello offers advice for parents on helping their children get better sleep.
Try and minimize a child's anxiety about the situation. I mean, that's what good parenting is, letting a child know that ultimately they're safe. There may be, or I'll keep you as safe as I can, so that these environmental things, now with, there are people talking about nuclear war, that's kind of stressful too, that I'll keep you protected from these things. So knowledge is good and it's helpful.
MD Network investigated current evidence-based guidelines for insomnia. According to the American College of Physicians guideline, there was insufficient evidence to support the use of medications such as benzodiazepines. The guideline recommends shared decision-making between clinicians and patients if medications will be added to cognitive behavioral therapy. Under their clinical considerations, the American College of Physicians states that medications should ideally be used for no longer than 4 to 5 weeks, and the skills learned in cognitive behavioral therapy can manage insomnia over the longer term. If after a trial of cognitive behavioral therapy, a shared decision is made to continue medications longer than 4 to 5 weeks, patients should be monitored for adverse effects. The need to continue the medication should be assessed at periodic intervals.